Hello everyone, welcome to my YouTube channel Knowledge Stone. So today we will discuss about the clinical study protocol. It is also known as the Bible of clinical trial. So in our previous video we have discussed about the various processes in clinical data management, where I have given an introduction on clinical study protocol and the basic knowledge of, or the for the clarification of your concept, I told you about the what is clinical study protocol. So now we will discuss about the protocol in detail. What is clinical protocol, or what is protocol? The protocol is a document that describes how a clinical trial will be conducted, the objectives, design, methodology, statistical considerations and organization of a clinical trial, and ensures the safety of the trial subjects and integrity of the data collected. With the protocol, the overall methodology, or we can say that all the guidance and instructions we can get. So it is a document which guides a particular professional who is working in the clinical research industry, whether he is working in the clinical data management or in the clinic as a clinical research coordinator, as a PI or principal investigator, or clinical research associate or clinical trial assistant. So they all need a protocol to understand the process of the clinical trial. So we will discuss about what are the various methodology, or how the protocol is designed. So I will show you a template of a protocol, how a protocol looks like, and it will be helpful for specifically for the freshers who are planning to start their career in the clinical research. So let's start. Here we can see a template or a model of a protocol, how a protocol document looks like, and I will give you a brief methods and what are the various contents of a protocol. So it will the protocol that is used in the clinical trial is similar to this template. So I will share the link of this protocol template, so you can refer to that and you will have a better understanding about the protocol. So first we will discuss about the title. So here you can see a clinical investigation. In title, the method or in which therapeutic area the clinical trial is conducted is mentioned. So here you can see a clinical investigation evaluating efficacy of a full thickness placental allograft in lumbar microdiscectomy outcomes. Sorry if I pronounced it incorrectly. So this is the title of the protocol. So here we can see who are the primary investigator or principal investigator. Next we will get to know about the sponsor. In my previous videos I have already discussed about the sponsor, so please go through that videos. In the next part we will discuss about the study summary. So in protocol, what is the summary and what are the topics we will cover in our next episodes. So the first is titled a clinical investigation evaluating efficacy of a full thickness placental allograft in lumbar microdiscectomy outcome. Methodology. The methodology of this clinical trial is randomized, controlled trial and blinded study. So what we will discuss about what is blinded and unblinded study. So in clinical trial it is conducted either by blinding both the investigator, not physically blinding. It is a term or terminology which is used to denote that the principal investigator or the doctor who is in charge of the trial in the particular site is not aware of the drug and also the subjects. So here principal investigator and PI PI and subjects both are not aware of the study is known as blinded, and unblinded or single blinded is the principal investigator is aware of the study drug, but the subject is not aware of the study drug, so it is known as single blinded. Double blinded, where principal investigator and the subject both are not aware of the study drug, and unblinded studies are where both principal investigator and subjects both are aware of the study drug. So study duration, this is another content. So estimated study duration tells us about the duration, about that clinical trial. So for how long the trial will be conducted, it is mentioned. Study centers, the sites specifically. So in which sites, whether it is multi-center, like it is global, or it will be conducted in India. So this protocol is designed for multi-center study. So it will be conducted in USA, or we can say Europe, India, Spain, Japan, Russia. So these for globally conducted studies are known as multi-center studies. Objectives. This is the most important part, and I would like to highlight this point about the objectives, that these objectives are whenever a participant or any job seeker attends any interview, most interviewers ask about if you have any knowledge about protocol, or what are the primary objectives, and the second, what are the objectives of the protocol you are aware of. Mainly for the experienced candidates who are looking for a job changer, who applies for a senior position, so they face this kind of questions during their interview. So do remember that primary objective or objectives are the important part of the protocol. So in this study or in this protocol, we can see the primary objective is to evaluate the efficacy of Revita. So here we can understand that Revita is a medicine or drug. Full thickness placental allograft in improving back and leg pain post microdiscectomy. Secondary objective, to evaluate post microdiscectomy herniation rate in patients treated with Revita. Number of subjects. So here 182 randomized patients in 2 arms, treatment and control. So here 182 randomized patients are enrolled for this particular study. Another important criteria is inclusion criteria and exclusion criteria. This is also asked during the interview question, that what if you know about the protocol, or if you have any knowledge on protocol, so what are the important parameters of a study protocol or of a clinical trial that is observed. So inclusion criteria and the exclusion criteria is one of the most important parameter in a clinical trial. Based on that, a subject is selected for the trial or they are rejected for the trial. So inclusion criteria are those categories in a particular subject that meets with the protocol required, or what should I say, that requirements that is needed from that particular subject to conduct the trial. So here male and inclusion criteria are categorized where male and female patients both are applicable. 18 to 70 years old subjects are applicable. So not less than 18 or 71 or more than 70 years. So suppose a subject with 70 years comes to the particular site, and when it is observed that the subject is 17 years old, so he or she is not included in that clinical trial. Another inclusion criteria is symptomatic with radiating low back and leg pain for greater than 6 months. So the subject should have low back and leg pain for past 6 months prior to surgery with a clinical diagnosis of lumbar protruding disc. So similarly, there are so many criteria, if I give you some of the examples, like the patient should be fertile, or the patient should be not more than 100 kilo weight. So these are the criteria. Exclusion criteria. So in exclusion criteria, male and female patients younger than 18 years old or older than 70 years old are not applicable. So as I discussed earlier during the discussion of male and female patients, 18 to 70 years are eligible in the is considered as the considered in inclusion criteria. Smoking, additional health risk factors, contraindicated with Revita use. Involvement with any other ongoing studies. So if the subject or if the patient is involved in any other clinical trial, so they are not included, because it is expected that in a specific clinical trial, a specific subject or those subjects will be selected who are enrolled in this particular study only. Study product, dose, route, regimen. So here the study product, what is the study product? We can see that Revita is the study product. Dosage, so the dosage we can say that is a control group. And route of administration is known the drug will be taken by orally or it will be given through the injections. So this is known as route. Next we will discuss about statistical methodology. So another important parameter in the protocol or in clinical trial is the endpoint. So do remember that earlier we have discussed about the objectives, primary objectives or secondary objectives. Some of the clinical trial may have primary objectives only, or some of the clinical trial may have both primary and secondary objectives. We have discussed about inclusion and exclusion criteria, and now another important parameter, which is endpoint. So as I have discussed that objectives are categorized based on the trials. Similarly, the endpoints are also categorized based on each and every trial. Suppose a clinical trial one clinical trial may have only primary endpoint. Another clinical trial may have both primary and secondary endpoint. So in this study or in this protocol, what is the primary endpoint? So the primary endpoint is low back and leg pain as measured by the Osworth Disability Index. This is a method which is used to measure low back and leg pain. So this method and 12 item short form survey. So the survey and this ODI method will be used in this trial to measure low back and leg pain. So to measure the particular disease is the main objective or the primary endpoint of this clinical trial. And what is secondary endpoint? It is reherniation rate. So in this trial, reherniation rate will be also checked for the subject who have the low back and leg pain issue. Now the purpose. The primary objective is to evaluate the efficacy of Revita. I will not discuss all the points in detail, just for the understanding of the protocol and the topics that is considered or that is covered in most of the protocol. That is I will be adding in this video. So the purpose. So purpose is what is the purpose of the study, and what is the basic points and what are the parts to be covered in this study. And here we can see the drug is Revita. So the why the Revita is used. So this will be included in the purpose of the protocol. Background. So background in the clinical protocol, the background of the study. So here we can see that microdiscectomy is a root procedure to alleviate herniated vertebral discs material. So here it is discussed about the disease and how microdiscectomy is used and the overall background of the disease and how all the methods are used or observation techniques are used is discussed in this part. Goals of the study. So each and every clinical trial should have a goal the main or the primary criteria for each and every clinical research professional is to meet the goals for the particular trial. So here the goal is to evaluate Revita, full thickness, placental, this medicines, and it is measured by ODI technique compared to the control group. To evaluate reherniation rate in patients with full Revita, Revita full thickness placental allograft. To improve ODI, that means the measured by using this ODI technique to check that the pain is decreasing and the subjects are getting benefit, subjects are benefited by taking this drug. So this is the main goal of the study. So we will understand for the particular study or for the particular trial, the main goal is to achieve the drug which is used or which is implemented for the clinical trial. It is useful, it has the effectiveness, and it is safe for the subjects. Duration of the study. So in any clinical trial, a duration or the timelines are mentioned in the protocol. So the in the protocol specifically, in most of the protocol, the average duration is 2 to 5 years. It may extend based on the requirement of the clients, or if any more subjects are enrolled. If after taking this drug the subjects are benefited and the scientist or the sponsor want to extend the clinical trial to observe the data for more subjects, so duration can be extended, but in most of the cases the duration of a clinical trial is maximum of 2 years. Now product description. Here the product is Revita. Similarly for other clinical trial, the drug is there. Here the background of the drug, how the drug works, and what is the introduction about the drug, how it was prepared, and all the designing methods are described in the protocol. Here product intended to use. So for who are eligible to use this product, so Revita is to be used as a wound covering or barrier membrane over chronic and acute wounds, including dermal ulcers or defects. Product acquisition. The Revita allografts will be purchased by Northside Hospital and STEAM labs at no cost to the patient. So here the guidance is given that as the trial is conducted in this site, so it will be purchased by that hospital or by the authority at no cost to the patient, and it will be served to the patient free. Potential benefit and risks to the patient. So here the scientists or the writers who have prepared the protocol will mention about the benefit, what is the benefit of Revita and what is the risk by taking Revita, and all the aspects will be mentioned in this section. Methods. Study design. So study design is the part where how the study is designed, how it will be implemented, how the study, how a particular clinical trial will undergo, and how all the methods will be done, and how all the tests or all the lab assessment, how the data will be collected. So these things are mentioned in the study design. So let's take an example of this protocol where the study design, in the study design we can see the blind study involving 182 subjects undergoing elective lumbar microdiscectomy will be placed in 2 randomized arms. Arms are like a divisions. One control group of 91 subjects will undergo a typical lumbar microdiscectomy without the addition of Revita. The other 91 will undergo a typical lumbar microdiscectomy with the addition of 2 to 2 centimeter Revita full thickness allograft. So here the study design, what we observed that 182 subjects are divided into 2 parts, where For first 91 subjects, they will undergo some observation methods or microdiscectomy without the drug, and other 91 subjects will undergo the process of microdiscectomy by giving the drug to them. Giving the drug to them. Once the microdiscectomy has been performed, a Revita allograft will be applied to the annulus of the index lumbar level just prior to closure in a manner according to the package directions and instruction for use per the sponsor. We don't need to discuss in very detail about the study design for this particular protocol, as I have taken it just for dummy or just for to show you how a protocol looks like. But do remember, the main concept of the study design is to follow the methods and follow the process, and how the drugs will be given to the subjects, and which instruments will be used, and which data will be observed are documented in the study design part of the protocol. So recruitment method, how subjects will be recruited. Subjects will be identified through existing patients of Polaris Spine and Neurosurgery Center, as well as through physician's referral. So what happens in a clinical trial, in most of the studies, principal investigator, who are also known as a doctor, they mainly introduce subjects, or they mainly refer subjects or their patients who are their long-term patients, or who are suffering from back pain or neck pain or spinal disease. So they the principal investigator or the physician suggests them that this new trial is ongoing, and here the scientist from that sponsor or from that company has discovered this medicine, so you can take this opportunity to participate in this trial. So if the investigator or physician convince the subject, and the subject feels that yes, I can take a part, if I can see if I get any benefit from the drug or not. So by this method, the subjects are also recruited. So here another important topics we will discuss about the expected outcomes. It is the sponsor's expectations that both short and long-term evaluations of the application of Revita will show improved patient outcomes over traditional microdiscectomy plans of care. Improvements in both ODI and SF12 scoring are expected from the treatment group compared to the control group. We need to understand about the treatment group and the control groups. The treatment group are those 91 subjects who have taken the drug, and the control group who were not provided any drugs, but they will undergo the observation via microdiscectomy process. So the group who are not introduced to the drugs are known as control group, and the group who has taken the drug are known as the treatment group. Adverse reaction. There is no expectation of any adverse outcomes or reaction due to a patient being treated with Revita. Revita allograft are minimally manipulated during processing and containing no additives or chemicals that would be expected to cause an adverse event. All participants will be given access to contact info of the PI or co-investigator perform their microdiscectomy. So suppose if any subject come across any adverse, or they feel that after taking this medicine they are suffering from various side effects or the adverse events or adverse drug reaction, so they will have the authority to contact their physicians or the principal investigators to inform them about these side effects. Any adverse reactions should be reported immediately to the PI or co-investigator. Now, another important topic is reasons for withdrawal or termination. A subject may be discontinued from the study at any time if the subject, the investigator or the sponsor feels that it is not in the subject's best interest to continue. Let me give you an example. Suppose a subject is suffering from fever after taking this drug. So later the investigator or the physician identified that this fever is mainly caused by taking the Revita. So the investigator tries to treat the subject so that they try their best to for the well-being of the subject, and the fever disappears. They are expecting that the fever will be disappeared after their treatment, but it is still continued and it is an ongoing and the fever is ongoing. So the investigator will inform the particular stakeholders and the sponsors, and if the investigator feels that it is not safe, for the sake of the safety and for the sake of the integrity or the ethics, the principal investigator may terminate the subject from that particular trial as per their health condition. So this can be considered as an example for the termination of the subject. Withdrawal. The withdrawal is a process where a subject is, maybe he is staying in some place and he is participated in a clinical trial. Suppose the subject is staying in Delhi and he has participated in the clinical trial, but later he is transferred due to the job, or he is going to his hometown. He's staying in some other place, wants to stay with his relative, so he is going to Mumbai. So it is not possible for the subject to continue the trial by coming to Delhi every month and participate in the trial, and in the next day or in that evening he will go to his hometown or native place. So it is not possible for the subject. So in this case, subject can withdraw from that clinical trial. So the following is a list of possible reasons for a study treatment discontinuation. The first is screening failure. The second is subject withdrawal of consent. Third, subject is not compliant with the study procedure. Adverse event that in the opinion of the investigator would be in the best interest of the subject to discontinue study participation. Protocol violation requiring discontinuation, loss to follow up, sponsor request to early termination of the study, and if the subject dies or the subject death is caused. So here is the another important part, that is known as the methods of study schedule, where all the methods, like each and every visits will be mentioned. The first visit will be baseline and screening visit, treatment visit. So all the visits are mentioned in the protocol. Early termination I have already discussed. Primary endpoint and secondary endpoint is also covered in this video. Now I will go to the main part of the protocol, where we can see the methods and what are the forms or what are the tests we need to perform for the trial. So it is also known as the schedule of events or schedule of assessment. So here in a tabular chart we can see it is right now blank, but when you will get an opportunity to work in a particular study or in a clinical trial, you will get to know in detail about the schedule of assessment in the protocol, where all the forms which is required for this clinical study will be marked as X. Suppose the screening In the screening visit, informed consent is required, medical and social history is required, inclusion exclusion criteria is required. So these will be marked as X. So whenever a subject comes to the visit in a particular site, investigator or the clinical research coordinator will review this part and will check which in screening visit which forms or which data we should collect. Similarly, in treatment month 1, all forms will be here. We can see the instruction or forms or all the tests that needs to be performed for the subject for that particular day. So this is known as the schedule of event or schedule of assessment. So if suppose informed consent is collected and here it is marked as X, but in treatment month 1, month 2 it is left as blank, that means informed consent will only be collected on the screening visit. In other visit it is not required. Similarly, physical examination like temperature, BP, heart rate, it will be here in, you can say this, all the sections are marked as X. That means these tests or assessments needs to be performed for all the visits. Let's take this urinary pregnancy test as an example. Suppose here it is blank, but in this 3 visit, treatment 0, month 1, month 2 and month 3, here we can see it is marked as X. That means urinary test will be performed only in these 4 visits. So that is why it is marked as X in here, in this columns or in this rows. So that's all about the protocol I have discussed. So please let me know if you have any questions regarding this clinical study protocol, and if I missed to cover anything in the comment section of my video. And also do let me know in which topic you want to understand, or in the clinical research area, in which section you want me to cover. So thank you so much for watching this video.